For some reason, doctors are always looking for the unified theory. What one thing causes all of these widespread problems? I came to the conclusion that's just wrong. That getting old has a whole lot of things that are going wrong. And the more of those things we can address, the better results we're likely to get. In our youth, our hormone loads are robust. And these are tools our bodies use. The anabolic hormones are defined as those hormones that allow you to grow lean tissue, for instance. So skin, muscle, ligament, tendon, the joint cartilages, your heart. Our anabolic hormone load peaks when we're about 17 or 18 years old, and then it starts going down and down and down and down. And as those levels are going down, we start getting slower and weaker, and we stop growing lean tissue. And if you can't grow lean tissue, what do you think you grow instead? Well, you grow fat. So the first thing I did was look at hormone balancing. And I came up with a theory that if we could move our hormone balance back to that we enjoyed in our mid-20s, we'd probably do a lot better. You know, when I was a country doctor, I would treat them for a problem, and they maybe resolve that problem, but when they came back a year later, they were a year older, slower, and more decrepit with more problems, and we'd work on those, and then they'd come back a year later with more problems. And over my 21 years as a country doctor, I was delivering babies to the babies I had delivered early in my practice and taking care of their parents still, who were now falling apart. I don't see that pattern in this practice. I see people in their 50s and 60s and 70s, but a year later, they're leaner, stronger, faster, smarter, and happier. I think the thing that sets us apart is we are probably the most comprehensive program of this type in the country. And we've also had the most experience. I mean, this clinic's been open full-time since 1997. I can't promise that I can make anybody live an hour longer, but if your heart is working better, and your lungs are working better, and your kidneys are working better, and your gut is working better, and your muscles are working better, and your bones are stronger, and instead of shuffling off down the street slowly, waiting to fall down, if you can run down the street and bound up the stairs, and if you fall down, you bounce and get back up and run again, my gut is you're going to live a lot longer. My number one focus was I wanted to help. And so for me, medicine has never been a job. It is, in a very real sense, my life's calling. I have put almost every waking hour into figuring out ways to help people have longer, happier, more joy-filled lives. And I think that's really what I'm trying to do, is I want to give people joy.